Welcome to Cost Saver Conversations. I'm Angela, and I ask the practical questions so you can quickly understand what matters. Today, I'm joined by Assad.
Hi, Angela. We are unpacking A&E versus Urgent Treatment Center, the UK guide to choosing right today, and tying it back to the wider cost-saver ecosystem, including tools like A&E versus Urgent Treatment Wait Time Calculator, so you can turn insights into action quickly.
Just a heads up before we dive in, we are your synthetic hosts. We are great with numbers, but as AI, we can sometimes be confidently wrong. Think of us as the digital versions of your most knowledgeable, slightly caffeinated friends.
Exactly. Treat this chat as a smart estimate only, not as professional financial guidance. Always check important details with official sources or a qualified expert before making any big decisions.
Hello and welcome back to the podcast. Today we're getting into something that I think, honestly, it causes a bit of a panic for most of us. That moment when you or someone you love needs urgent medical attention and you're just standing there going, where do I actually go? A&E? Urgent Treatment Center? What's the difference?
Yeah, it's such a common dilemma. And I think your first instinct, right, is to just Google nearest A&E wait time and pick whichever one looks quickest, which, totally understandable. But that instinct can actually cause you quite a lot of problems.
Problems how? I mean, apart from the obvious of like maybe ending up in the wrong place.
Okay, the big one is time. People end up waiting hours longer than they need to. The NHS data actually shows that picking the wrong venue can cost you around 4 to 6 hours of your day. And then there's the stuff nobody thinks about. Parking, fuel, food. You're looking at probably 15 to 30 pounds before you've even been seen by anyone.
Oh, I didn't realize it was that much. I always just think, NHS, it's free, off we go.
Right. And that's just the start of it, honestly. But the core thing people need to understand is that the urgent care system is designed in layers. It's a tiered network. A&E, or emergency departments, same thing. They're for genuine life-threatening emergencies, heart attacks, strokes, severe bleeding, major fractures. They've got emergency medicine consultants round the clock, surgery, critical care, all of that.
So the really serious stuff.
Exactly.
And then what about these urgent treatment centers, UTCs?
Yeah, so UTCs are kind of the middle tier. They're GP-led, usually open at least 12 hours a day, and they handle urgent but not critical issues. So sprains, minor head injuries where there's no loss of consciousness, cuts that need stitches, minor burns, infections like UTIs or ear infections, even suspected broken fingers or toes. And a lot of them can do x-rays and basic blood tests, which is, yeah, that's pretty handy.
So if my kid, twists their ankle on the trampoline, classic Sunday evening disaster, that's a UTC job, not Annie.
That's a textbook UTC scenario. And the difference in wait times is, it's significant. We're talking 60 to 90 minutes at a UTC versus potentially 4 hours plus at A&E for something non-critical.
Wow, that's a massive difference.
It really is.
And where do pharmacies and NHS 111 fit into all this? Because I sort of forget they exist when I'm panicking.
Yeah, no, you're not alone there. But they're really important. Pharmacies are brilliant for minor ailments, and with the Pharmacy First scheme now, they can actually treat 7 common conditions, things like earache, sore throat, uncomplicated UTIs. And then NHS 111, honestly, Angela, this is your first port of call if you're unsure. They triage you over the phone, and here's the thing most people don't know. They can often book you a specific appointment slot at a UTC or even at A&E, so you skip the walk-in queue entirely.
Wait, really? They can actually book you in? I thought 111 was just for advice.
No, they properly book you in. Takes about 10 minutes on the phone. It's a genuine game changer, and most people have no idea it exists.
That's actually really reassuring to know. Okay, so let's get into the mistakes because I have a feeling I've made at least a couple of these.
You and everyone else. Right, so mistake number 1, only looking at the headline A&E wait time. You see something like average wait 3 hours 20 minutes, and you think, okay, that's what I'm in for. But that's an average across all patients. If someone comes in with chest pain, they're seen in minutes. If you've got a sprained wrist, you could genuinely be sitting there 6 hours during a busy shift, even though the average says 3.
I hadn't thought about it like that. I always just see the big number and take it at face value.
Yeah, and averages hide the tail of the distribution, and the tail is where most of us end up. So if you can find a calculator that shows a range or a percentile figure, that's much more useful. And, oh, and time of day matters hugely. Weekday mornings are usually the quietest window.
What about the worst times?
Friday and Saturday evenings, between about 8 p.m. and midnight, busiest hours in most English A&E departments. So if your problem can safely wait until Monday morning, you'll wait far less and honestly get better attention.
Fair enough. Avoid the Friday night crowd.
Exactly. Okay, mistake number 2, ignoring total journey time. This one catches so many people. Your nearest A&E might advertise a 2-hour wait, but if it's a 40-minute drive across the county, you've already burned significant time before you're even triaged. Meanwhile, the UTC down the road might have a 45-minute wait and be 5 minutes away.
Right.
And there's this example. A lady from Leeds, Sarah, took her son to a big teaching hospital A&E for a suspected wrist fracture. Total time from leaving home to being discharged with a cast, 7 hours, plus 22 pounds in parking. Her neighbor, almost identical injury, 2 weeks later, went to the local UTC instead. 2 hours 15 minutes for parking. Same outcome.
5 hours and 18 quid difference? That's a lot.
It really is. So you've got to think about the full picture. Travel plus wait plus consultation plus any onward referral. Does that make sense?
Yeah, completely. What's mistake 3?
Assuming all UTCs are the same. They're not. Some don't have X-ray facilities on site. Some close at 8 p.m. or 10 p.m. Some won't see children under a certain age. And if the UTC can't X-ray your suspected fracture, they'll just send you on to A&E anyway, and you've doubled your journey.
So you can't just see the words urgent treatment center and assume it's a one-size-fits-all thing.
No, and actually, this is worth flagging. Some places still have minor injuries units, MIUs, which have a very limited scope. They might only do cuts, strains, simple wound care. The names are used really inconsistently across England, Scotland, Wales, and Northern Ireland, so always check before you set off.
Good to know. What else do people get wrong?
Okay, so this is a big one. Mistake 4, going to A&E for a repeat prescription or an ongoing condition, something that's been rumbling for weeks. You'll just wait hours to be told to see your GP.
I feel like I know people who've done this.
Everyone does. And look, if your GP is closed and you genuinely need medication that night, ring 111 or ask a pharmacist. Many pharmacies can issue emergency supplies of regular medications, usually for a small fee of around 10 to 15 pounds to cover the medication itself.
And with children, I guess there's another.
Yeah, mistake 5, not checking children's services. Some hospitals have dedicated pediatric A&E, which is brilliant, but some UTCs won't see under 2s or under 5s, so the calculator's headline number might not even apply to you. A wasted trip with a poorly toddler in the car is, yeah, nobody wants that.
Oh, that's actually really important. I wouldn't have thought to check that. So, coming back to the hidden costs, you mentioned parking and fuel. What else adds up when you get it wrong?
Oh, loads. So lost time, obviously. 6 to 8 hours gone if you've picked the wrong place. Parking, $3 to $5 an hour at a lot of hospital car parks, so a 6-hour visit is $20 to $30. Missed work. If you're self-employed or on a 0 hours contract, that's potentially $80 to $150 in lost earnings for a day shift. Then there's childcare knock-on effects. Scrambling for someone to collect other kids from school, short-notice childcare can be $15 to $25 an hour. And fuel. If you're driving further when a closer UTC would have done the job, another 10 to 15.
That really adds up, especially if you're, already budgeting carefully. It's kind of a lot.
It is. And here's a pro tip that could save you a ton of hassle. If you visit a UTC and they refer you on to A&E, ask them to phone ahead. Some UTCs can book you a specific slot at A&E, so you're not starting the queue from scratch. That alone can save 2 to 3 hours.
Oh, I love that. Okay, so with all these pitfalls, how should we actually use these tools properly? Like, what's the right approach?
Right. So it's basically a 7-step thing. First, assess severity honestly. If it's life-threatening, chest pain, struggling to breathe, unconsciousness, severe bleeding, ring 999 immediately. Don't open a calculator, don't pass go.
Right.
Second, for anything ambiguous, ring NHS 111. They'll triage you, often book you in. Takes 10 to 20 minutes. Third, then open your comparison tool and compare your nearest A&E and UTC on current wait times. Fourth, add travel time. Use a Maps app for realistic evening or weekend traffic. Fifth, check the UTC scope. Can they handle your specific problem? Do they have X-ray? Are they actually open?
And sixth?
Factor in age and specialist needs, especially for young children or elderly relatives with complex conditions. And seventh, just bring entertainment and snacks. Even short waits can stretch, and hospital vending machines are expensive and grim.
That is the most practical medical advice I've ever heard on this podcast. Love it.
I mean, it's true though. A dead phone battery and no snacks at 11 p.m. in a waiting room is its own kind of emergency.
Fair. Okay, so what about doing some prep before you actually need any of this? Like when you're not in panic mode?
Yeah, this is the thing I wish everyone would do. Just spend 10 minutes on a quiet evening, look up your nearest UTCs, their opening hours, whether they have X-ray on site. Save that info in your phone, because when you actually need it, you're not going to be calmly browsing hospital websites while dealing with a screaming child or, your own pain.
That makes so much sense. And I suppose wait times fluctuate a lot, right? So you can't just look at it once and
Exactly. A snapshot at 2 p.m. doesn't guarantee the same wait at 8 p.m. Always refresh the calculator just before you leave. And if something delays your departure, refresh it again.
good. Now, when should you definitely skip the calculator altogether? Like, just don't even bother.
So anything on the 999 list, obviously. Chest pain, stroke symptoms, severe bleeding, unconsciousness, difficulty breathing, major trauma, severe burns. But also suspected meningitis, especially in children, severe allergic reactions, suspected sepsis. That's things like confusion, blotchy skin, extreme fatigue, high fever. And honestly, any situation where you feel genuinely frightened for someone's life, just ring 999.
Yeah.
And this is important. Never drive yourself to A&E if you suspect a heart attack or stroke. Ring 999. Ambulances aren't just transport, they're mobile treatment units. Paramedics can start treatment on scene, and calling one won't affect your credit or your insurance or land you with a bill or anything like that.
That's really worth saying because I think people worry about, wasting an ambulance's time.
Yeah, and that's a lovely instinct, but if it's genuinely life-threatening, that's exactly what they're there for.
Okay, quick fire round. Will I be taken less seriously at a UTC?
No, not at all. UTC clinicians are experienced GPs, emergency nurse practitioners, paramedics. If your case turns out more serious, they'll fast-track you to A&E.
What if I go to a UTC and they can't help?
They'll signpost you on. You've lost maybe 30 to 60 minutes, not the whole evening.
And is calling 111 a waste of time?
Definitely not. It handles millions of calls a year, books thousands of same-day appointments, prevents so many unnecessary A&E trips. It's free from any UK phone. Honestly, it's underrated.
Oh, and I should ask, does all of this apply the same way across the whole UK? Because it's not one system, is it?
Good question. No, it's 4 separate systems, and urgent care varies quite a bit. England uses UTCs and some legacy walk-in centers alongside A&E, but the UTC rollout is still patchy. Scotland uses minor injuries units and A&E with NHS 24 as their phone triage, though 111 still works there. Wales is similar to England with minor injuries units, and they've got NHS 111 Wales. Northern Ireland uses emergency departments and minor injuries units with phone-first arrangements in some trusts.
So if you move house or you're traveling, don't assume what you're used to still applies.
Exactly. It's one of those things you need to check for wherever you are.
Right. So, to wrap things up for everyone listening, what's the takeaway here?
I'd say it's 3 things, really. 1, honest assessment of severity. If it's life-threatening, ring 999, full stop. 2, for anything ambiguous, make that quick call to 111. It's 10 minutes that could save you hours. And 3, when you do use a comparison tool, think about total journey time, not just the headline wait number. Factor in travel, check what the UTC can actually do, check they're open, check they'll see your child's age group, all of that.
And do your homework before you need it.
Yeah, spend 10 minutes on a quiet evening. Know your local options. Save them in your phone. Because the shortest wait time isn't always the best care if the venue can't actually treat your problem. Use the NHS wisely. It only works if we all do our bit, you know?
Brilliant advice, Assad. Thank you so much for walking us through all of that today.
My pleasure, Angela. Stay safe, everyone.
Quick side note, this guide connects with other cost-saver blogs, especially Help to Buy Equity Loan and its RPI-linked fees, checklist for verifying local service providers, and postcode crime data before renting a property.
Exactly. And reading those together helps you connect the dots across your household budget, not just this one topic in isolation.
And if you want to apply this immediately, jump into tools like A&E versus Urgent Treatment Wait Time Calculator right after this episode.
Primary sources used here include NHS, When to Go to A&E, and NHS England, so you can verify the data yourself and stay evidence-led.
That wraps this cost-saver conversation with Angela and Assad. If this helped, share it with someone who could put these ideas to work this week.
Your next step is simple. Try A&E versus Urgent Treatment Wait Time Calculator, then read Help to Buy Equity Loan and its RPI-linked fees, and use them together to take action today.